All right. Good afternoon and welcome. I see a lot of people are hopping on, so I'll give everyone a moment just to join. And I will also just add our Spanish interpretation instructions in the chat box. But I will get us started because I know we have a lot to discuss today. So welcome to our Include NYC Live Wellness, Practical Strategies, and Meaningful Support for Young People with Intellectual and Developmental Disabilities. My name is Kylie, and I will be your Zoom support for today. And we have Madeline Maldonado and Sherelle Cruikshank, who will be leading our discussion for today. Just a little bit about Include NYC. For more than 4 decades, we have been helping young people with disabilities, their families, and professionals. We offer workshops such as this session today, a helpline, and a variety of resources on our website. And I will be adding both our Include NYC helpline phone number and our website in the chat for you all in just a moment. Just a couple housekeeping notes. We are in webinar mode for the workshop today. So when you enter, your sound is muted and your video is off. But if you do have any thoughts or technical issues, we have our chat box available and our Q&A box open for any questions. Just note, we do have a lot of folks signed up for today's session. So we might not be able to answer every question, but we will have some information in the chat box for you all to follow up as needed. As I mentioned, we are having Spanish interpretation for today's session. So to access that, you can click the interpretation or globe icon in your Zoom webinar controls and then click Spanish. And we also have subtitles in multiple languages for today. So you can use those by clicking Show Subtitles in your Zoom webinar control. I will pass it over to our lovely presenters for today to give you all the fun content and a great discussion.
Thank you, Kylie. Good afternoon, everyone. I'm Sherelle Cruikshank, and I am the very proud Executive Director at Include NYC. Kylie mentioned a little bit about us, but I'll share a little more about the organization. And Include NYC is the leading provider of training and information for young people in New York City with any disability, from the age of birth to the age of 26 years old, as well as their families and the professionals who support them. And as a citywide nonprofit, we supported over 15,000 people and reached over 400,000 New Yorkers through communications and community outreach, all free of charge to any of our participants in 2024. We really envision a world where there is love, equity, and access for all young people with disabilities. Today, I'm excited to continue our series of conversations to explore various aspects of wellness and how people with disabilities succeed in the face of challenges. Today, my guest is Madeline Maldonado, a licensed bilingual clinical social worker and seasoned leader bringing over 2 decades of expertise in mental health advocacy, program development, and culturally responsive care. Individuals with disabilities face physical, systemic, social, and every other barrier you can think of as they navigate a world that was not made for them. Yet many people with disabilities have developed unique strengths through experiences that foster creative problem solving, innovation, and resilience. Mental wellness plays a large role in the life of a person with a disability as well as their families. Thank you for joining our conversation with Madeline Maldonado. She's a therapist and she's an evaluator of early intervention services for children with disabilities to help us unpack this very important and complicated subject. So welcome, Madeline. Why don't you share with us, why did you choose this field of work?
Thank you for that lovely welcome, Sherelle. Thank you to everyone who's here. Bienvenidos a mis latinos, personas que hablan español. Es un placer. I just wanted to welcome the people that are Spanish speaking and acknowledge them that they are here. So I chose this field because I have a passion for mental health, for understanding the mind, for understanding what makes us do what we do. And I also genuinely love people. I enjoy people. I like listening to people and hearing their stories. And I'm deeply moved by hearing people's experiences, whether it's mental health experiences that they've had, challenges that they've had, the highs, the lows, the joys. I love all of it. And it really is an honor to be able to spend my life doing a career that ties into how much I love people and how much I enjoy listening to people and helping people. And I'm also a born and raised New Yorker, native New Yorker, and I am a Dominican American from immigrant parents from the Dominican Republic. So I also have a lot of ties to the communities here, communities of color, whether it's black, brown, Spanish speaking, and I see the need. I see the need and the reality of the challenges that our particular communities face, and I wanted to make a difference. So here I am.
Well, from that smile on your face, I could see how warmly this touches you. So let's start at the beginning. So can we talk about why early identification of any type of developmental delay is so important?
Well, the reality is that the sooner you address any concern, the better the likelihood is of being able to do something about it while it is still in the beginning stages. That applies to anything. So, if we have a physical ailment, it's easier to get treatment for, let's say, a cold than for full-blown RSV or COVID-19. So in the same way, if you see that a child has a mild speech delay, just a few months, it's important to start paying attention and noticing. If you see that your child is a very picky eater and isn't adapting to different foods, let's pay attention to that because these things, when they're still small, are more manageable. Once things, compound and the problem has been around for months and years, the treatment becomes more complicated.
Okay, that makes sense. So why do you think that parents delay getting their children assessed when they see certain behaviors that seem not in line with their age or even just seem inappropriate?
In my experience, I think that parents don't always know what's typical and not typical in terms of development. For example, there's new parents who they've never been around little children. They just don't know. They haven't memorized all the developmental milestones. We're all so busy nowadays. Maybe, they haven't had time to look online and research something. And I think that sometimes when parents go to see pediatricians, they're also told, give this time, let's see. A lot of parents have shared with me that they're told that age-old stereotype, boys develop slower than girls. So give it another 6 months. By the time they get an appointment, it's really 8 months, and time just flies by. And there's also, I think, a group of parents that honestly just are afraid of getting bad news. And I say bad, because this is something that they think is going to be something negative or something that will hurt the child. So they're worried about getting bad news. And so they avoid as long as they can. Um, and this is normal. This is normal human functioning. Nobody likes to get bad news. Nobody likes to feel any pain. I don't like going to the doctor if I know I'm going to get shots or get a painful procedure. So this is just our brain's way of kind of delaying when we think we're going to get bad news. And then we also know that there are barriers to being able to get assessments and evaluations. So I've been told by some
Absolutely.
parents they did ask their doctor, they did look online, they did make phone calls, and they were put on waiting lists or they weren't called back. And so all of a sudden, this is delayed, even though they started the process maybe 6 months or even 9 months ago.
Wow, that's a lot of delay. So you brought up there are systems in place to help to support children at different ages. Let's start from birth and tell us about some of the systems that are in place that provide interventions and treatment for children.
Okay. So for children ages 0 to 36 months, so newborns all the way to 3 years old, you have the two primary programs that help with interventions are Head Start, early Head Start, which is for children 0 to 36 months, and then the regular Head Start, which is for 36 months to 5 years old. They provide more of the education, teaching, kind of like little daycare preschool environment. They do have accommodations for children with disabilities, but that is not the primary focus of the program. Head Start also does, nutrition, help for families, and case management. So, they do a little bit of different things. So, the program that is here to evaluate and provide services for children 0 to 36 months is the early intervention program. That's the program that if a parent suspects their child could have a delay of any kind, they should reach out and initiate a evaluation for their child. And then from 36 months to 5 years old, for children with developmental delays, the Department of Education has the CPSE program. That's the Committee on Preschool Special Education program. That allows for a child to get preschool services in a school setting and also get therapy alongside of that. For children that are older, age 5 and up, you have the Department of Education. They have their CSE, the Committee on Special Education program, which is legally mandated to provide services for any children that have developmental delays or disabilities and need accommodations for learning.
And if for a parent that is noticing some early delays or concerns, where do they reach out to find early intervention programs, early intervention services? How do they even find that?
Well, the easiest way is to call 311. If you call 311, you can initiate a self-referral to early intervention. A lot of parents think that you need an actual referral form or you need the doctor to call for you. The doctor can make the referral and give you a referral form, but it's not necessary. Even if your doctor does not agree with you and you're saying, I want this, I think my child could have an issue, and the doctor's like, just wait, you can still call 311 and just make the decision as mom or dad and request the evaluations for your child. And in terms of the Department of Education, you reach out to the Department of Education field office. There's different ones in every borough. You can find the number on Google or ChatGPT or any AI that you have, or call 311 and ask them for the phone number and address to the Department of Education field office in your neighborhood. And they'll look it up based on zip code and tell you where to go. And as a parent, you have the right to walk in and request evaluations. You sign consent forms, and they're supposed to respond to your request.
Perfect. That sounds good. And I know that many of these programs and they have delays. What's like the average you as a parent that you should expect in terms of the time that it takes to set up an evaluation for your child?
That's a great question. The early intervention program and the Department of Education are mandated with particular timelines. I mean, there are delays, but they also have timelines that they're supposed to adhere to. So, for example, with early intervention, it's 30 to 45 days after the initial call and the parents signing the documents to start the process. If there's a delay beyond the 45 days, we are required to have explain to the parent the reason for the delay and have them sign a document saying they were informed of the delay and the reason for delay. And with the Department of Education, it's approximately the same 30 to 45 days to start the process. Now, due to high volume, I want to make sure we share that there is high volume. You can get connected to a provider, but sometimes that provider has a backlog. Like in my example, I am booked usually 4 to 6 weeks. And if you miss an
Okay. I
appointment,
thought you were going to say months. So I started to hold my breath. I was like, oh gosh,
four
weeks.
to six
Okay.
weeks. So, but parents know as long as they don't cancel or need to reschedule, that's about, the delay that it will be. So I would say it could be 3 months. I would say 90 days. Parents have to be ready to wait about 90 days. So that's why it's imperative that if they have a concern, they don't wait because the process is going to take about 90 days anyway.
Anyway, right, right. And at Include NYC, we have a helpline that parents can also call and receive resources and information about available services. So I know Kylie had mentioned putting the number in the chat, so that's also a resource. But how do parents with all these different programs and options, how do parents begin to understand and decide where it's best to take their child?
Well, I think that the first person they speak to should be the pediatrician because the pediatrician should know the child. They have the child's medical records and they can kind of go over the progress or lack of progress that the child has made in their development. The pediatrician can also make the referral to early intervention or to specialists because sometimes the pediatrician may feel that the issue with the child is medical. For example, a child with a feeding issue, a child that's not eating, let's say, solid food, a pediatrician may feel that that child needs to see a gastroenterologist, have their stomach checked, have their throat checked. They may send them to an ENT to make sure we're swallowing properly. There's no sinus or nasal problem affecting them from being able to eat. So, or a speech pathologist may be the person they recommend to check if the child has a tongue tie or something like that. So the doctor may feel it's a medical problem and may refer to medical providers before recommending developmental evaluations. But I think that the pediatrician should be the first line of defense. And then I think that we kind of have to be curious. We need to go online. Let's start looking up some parent groups. For example, Include New York has a lot of resources on the website. There are parent groups online on Facebook that are specifically for parents of children that have developmental delays. And parents, I'm a member of those groups and I see that they respond. If a parent posts, I need help finding this for a child, there is a parent there who will respond and post the response or give you a lead of some kind. Um, we also have people in daycares. Daycare providers are so underutilized in that regard. A lot of them know
Hmm.
about great resources. So if you're taking your child to a daycare, don't be afraid to ask the daycare provider, hey, do you know of services, for this concern of mine? And if they know, they'll usually tell you. Or if they know another parent that knows, they can call that parent and find out. And then again, like I mentioned previously, 311. We don't think of 311 as this huge resource, but New York City has really expanded 311, not just on the phone, but on the website too. You can go to the 311 website and find a host of resources there if you have the patience to read through it and look.
Okay, so there are many options for parents to find information. Include NYC has parent support groups, and there are many other parent support groups about. I love your idea also about looking online. You can find just about anything online. So that's also a great place to find some support. So the family has gotten this information now. How do families transition to actually accessing care and reducing the barriers that children have in receiving care?
I think the first thing that parents have to be aware of when they undergo this process is that it is a process. I have spoken to so many parents who are deeply frustrated. They might even cry from the frustration. because they feel that this takes too long and there's a lot of paperwork and a lot of appointments and a lot of phone calls. That's part of this process. So the first thing is to kind of tell yourself and open your mindset to the reality that this is going to be a long process. Like I said, it could take between 30 to 90 days. It's going to be a lot of paperwork. Every appointment, every evaluation, every meeting has at least 3 to 4 forms that need to be filled out. You will be getting emailed paperwork. You will be getting multiple phone calls, multiple appointments. Some may be conveniently located. Some may be not conveniently, in terms of transportation wise. So getting it in your mind that this is just a process that we have to go through in order to get to the end result, which is the help and the services. That helps so that you're not overly frustrated in the face of what's normal to us who work, those of us that work in these programs, these are normal delays, but for someone waiting, it feels overwhelming. So that's the first thing. And then I think that it's important to understand that the recommended evaluations really are going to be critical to the child getting services. So a lot of times parents will decline certain evaluations because they don't understand the benefit right away, or again, they don't want another appointment, more forms, possibly having to travel, so they'll just decline. But in order to give your child the best services, you need thorough evaluations. So, for example, if the child is recommended for a psychological or clinical evaluation, there's a reason for it. These are not just random evaluations that are recommended. So if the child is recommended for it, it means somebody who evaluated this child was seeing something that needed further evaluation by that professional. So accept the evaluation, even if it's an inconvenience. Let's get to the bottom of what's happening. In the same way, a parent is also going to need a psychosocial history, which means get your documents in order. It feels overwhelming, but it's necessary. Have your medical records, have your child's physical, a list of your child's medicines. Those things are really important so that providers can document a nice comprehensive history that can go into these evaluations. And this is how they make determinations on approving services for children. And having a good relationship with your medical doctor is important because there are forms that only the medical doctor can provide. A quick example, in the early intervention program, your child can be recommended for occupational therapy evaluation or speech therapy evaluation or physical therapy evaluation. Your primary doctor or pediatrician has to sign a prescription stating that they're approving it. So if you don't have a good relationship with your doctor, or every time you go to the doctor, you see a different doctor for your child, it's harder to get that form filled out. So that's one of the reasons for the delay. The child is recommended, but your doctor may take a month just to fill out and stamp a form. But that form could take a month. So the parents that have
Right.
better luck are the ones that have a great relationship with their doctors. They call up the doctor's nurse and say, I need this form urgently. If I take it there tomorrow and wait, I'll wait all day if I have to. Can I get the form? Those are the parents who, move this
Get what
process
they need.
along. Yes,
Mhm.
yes,
Yeah.
yes.
And what about other barriers to services? What are some of the things that the parents are experiencing, um, and how do they navigate some of these barriers, like
Uh,
cost, for instance?
Cost is always a factor. For people that are insured and have health insurance, and all children in New York do have health insurance, um, there are still things that health insurance doesn't cover. For example, transportation costs. So again, if you get an appointment with a great doctor that's in Brooklyn and you live in the Bronx and you know that your child does not do well on public transportation, you now have to figure out how to get a taxi or some kind of transportation service. So cost is always a factor. There are things that even though the insurance covers it, there's still a deductible or copay for people that have those types of insurance plans. And there's also doctors and providers who don't take insurance. You need them, they will do the evaluation or provide the service, but they don't take insurance. They're just not contracted with insurance. So as a parent, you always have a choice. You can either go with the provider that's in network and takes your insurance, but maybe that person has a 6 month waiting list and there's somebody who can see your child right now that will see them if you're paying out of pocket. So cost is a factor, and it also can be a barrier because everyone can't afford to pay out of pocket. And evaluations can be very expensive. I mean, to give you a range, psychological evaluation can range from $1,500 to $3,500.
Ooh,
Yeah,
that's a lot.
which is why insurance doesn't always want to pay for it in full. It's an expensive evaluation.
And are there free options? Is there a free way that families can get these evaluations?
There are free and low cost ways. The participants for today's webinar will be sent a list of agencies that do provide low cost or free psychological evaluations that can even be
Wonderful.
utilized for things like applying for OPWDD. There's also organizations that provide assistance with paying for evaluations for families that are either undocumented or have significant financial limitations. So these things do exist, but again, we have to apply, we have to do the paperwork. So it's a process.
And
Um,
what about language barriers? How do families get support around language barriers?
Language barriers are a huge thing. Clients, patients do have the right to translators and interpreters. Unfortunately, many people don't know that and don't ask for it. So I know that
Mm,
in any hospital has a language line. If they don't have a human being there who speaks the language, they have a language line which they can access. The early intervention program also has access to translators and interpreters. Schools also can use those services, but they leave it up to the parent to say they need the interpreter. And
mm,
what I have found is that sometimes we're very proud in saying we need an interpreter.
asking for help. Yep.
Yes,
Yep.
but if you do not feel comfortable having a conversation with a medical provider or a school staff or a professional 100% in English, then you should ask for an interpreter because these are very important things that are going to be discussed and you want to be 100% clear. Sometimes, despite your best efforts, there is no language line or interpreter at the agency. This is where I say to parents, do you have a trusted family member, a friend, a neighbor, someone that can help you as an interpreter during this appointment if you give them advance notice? So again, we need to ask for help. Even another parent that has been through this, but they speak more fluent English, they can be your interpreter. You can bring whoever you want to your child's appointment. As long as you're consenting that that person is representing you, you can bring your own interpreter if you have one.
It's important to know your rights. It's important to
Yes,
know what you're entitled to so that you can access services. And
absolutely.
Include NYC also uses a language service for people who speak other than Spanish or English so that people can always call us regardless of in the language that they're most comfortable with, and we can communicate with them. So you dropped OPWDD. So let's talk about that. The Office of People with Developmental Disabilities. So what's the role of OPWDD and how do they relate to mental health services? Because usually when you think about OPWDD, you only really think about developmental disabilities, intellectual and developmental disabilities, and not necessarily mental health services. So, can you give us that relationship?
Yes, yes. So OPWDD is supposed to provide access and connection to additional services for people with developmental disabilities and developmental delays. So parents can apply for OPWDD services starting when the child is 3 years old. So as they're aging out of, let's say, an early intervention program, they can apply for OPWDD as an additional support. I always stress to parents, OPWDD cannot be your primary support. This is not what this agency was created to provide. So it serves as an adjunct to everything else that we've been talking about in this conversation. So OPWDD can help with things like case management. They can help parents access additional therapies. Let's say the child is supposed to get speech therapy at school, but there's no speech therapist at the school for a particular period of time. Through OPWDD, they can help the parent access speech therapy in the community, or maybe have a private speech therapist who can come to the home. That's just one example. As children get older, they can help provide them access to recreational activities, swimming classes, horseback, I don't know, things like that. Whatever works for the child's development and interest, the care manager through OPWDD can connect them. OPWDD can help older adolescents and young adults with housing needs. So starting to plan for transition to either supported housing programs where they live in a environment where they have social workers and care managers, or something else. There's different options. But in terms of mental health, we have to remember that people with developmental delays and disabilities can still have mental health challenges. By mental health, we're talking about things that have to do with emotions and behaviors. So someone who has autism can also have depression. They can have anxiety. Somebody who has intellectual disability or learning challenges can have bipolar disorder, let's say, or they can have any kind attention deficit disorder. So it's important to treat the mental health component along with the developmental delay and disability. And that's where we see OPWDD can link families to mental health resources in the community, such as therapists, psychiatrists, support groups, and again, activities that help with mental health, like peer support groups and things of that nature.
So there's a quick question in the chat. So I'm gonna just share that with you. Can a child with DD, developmental disabilities, qualify for Medicaid even if their parent works and is insured?
They can. It's a matter of applying, and then they have to go through the eligibility process to determine how significant the disability is. Because, if the child is deemed to be very mild, they may say that they don't need straight Medicaid. If the child is more moderate or severe and needs a significant number of services, which the private insurance will not cover, that's when they could approve the Medicaid to cover what the primary insurance, that gap. So let's say the primary insurance covers 80% of the medical bill, and then the parent is left with the 20%, they can have Medicaid pay the 20%. But it's a case by case basis. And they look at everything from finances to savings to, just everything. So it's a process, but it can happen.
Okay, so getting back to what we were talking about with mental health services and people who they use the phrase duly diagnosed. So they have a developmental disability and they may also have a mental health issue. What does active mental health treatment look like for a child with a disability?
Well, it means addressing the term that you just used, the dual diagnosis. So we have to work. If we think of like a seesaw, remember the seesaw when we were kids at the park, goes up and down,
Mm-hmm.
and
Yeah.
the goal is balance. Two kids that kind of weigh around the same, and then you could keep it up like that. So you want to make sure that if the child has developmental delays on one side and mental health issues on the other, that you're treating both, and that you're treating both at the same time. So that means therapies and treatments for the developmental delays, speech therapy, occupational therapy, ABA therapy. And then it also means the other side, looking at, does my child need psychotherapy? Does my child need individual psychotherapy and then maybe family psychotherapy? Because I need to work on how I'm interacting with my child or how my child is triggering me. Do I, as the parent, need my own therapy in order to help support my child? Do I need
That's a
couples
very
therapy?
important point. Parents
Yes,
do not take care of themselves,
yes,
and this is a very um, it's a very tasking on your body mentally and
yes,
physically when you're doing so much to care for a child with a disability, and
yes.
parents tend not to take care of themselves. So that's a really good
Yes.
point that you made.
Yes. Not, thank you. Not to go too far on a side note, but I think one of the beautiful things that comes from the child getting mental health is that a lot of times the parent and other family members are also offered the help. And if they're open, they get it as well. So we see the changes in how the whole family feels and is functioning because the child started getting the therapy. And
Nice.
psychiatry. I mean, there is a place for medication in terms of mental health and behavior problems in people that have mental health and developmental delays and disabilities. So they all work together. They all work together in order to be what I call active treatment.
Very important active treatment. So, medication is always um, a hot topic for parents, and many parents don't want to use medication to address their children's behavior or some of their other symptoms. Can you talk a bit about what role does medication play in treatment?
Medication helps with behavior symptoms and it helps with mental health symptoms. Medication is not a cure-all for developmental delays. It will not cure developmental delays. And it also will not change things that require behavior interventions. Sometimes, for example, if I've met with parents who will say, my child is oppositional, they don't want to follow rules, they, will push me or fight me when I try to do certain tasks with them. That's behavioral. So it means we need behavioral therapy like ABA and psychotherapy to work on those behaviors. There's no medication that's going to change those symptoms per se. Now, medication can help with sleep problems. It can help with anxiety. It can help with mood swings, with impulsivity. It can help with aggression if the aggression is due to some kind of like chemical imbalance of the brain. And it also can help with hyperactivity. Some There's a percentage of people who have developmental delays and disabilities that have attention problems and can be hyperactive at times. So medication can help with that. It can help level the chemical imbalance and the neurological challenges that are occurring in people with those conditions. Now, medication, like I shared, is not a cure. We do have to make sure that number one, we're using the correct medication. And it involves parents really sharing with the prescriber details of what's happening and then tracking. Because if, parents might say, for example, oh, my child is still not sleeping and they're being prescribed a medication for sleep. Okay, we need to track what's really happening. What time are we giving the child that medication? What kind of foods are we giving that child throughout the day? Because a child who's hyperactive, if you give them sugar, soda, processed foods, or even too much juice, I've outlawed juice in my practice for that reason, because it can make kids very hyper. It doesn't make me hyper, but it can make kids very hyper or people with developmental delays and disabilities. So tracking that. If you give a child a sleeping medication and they had it with juice or soda right before bed, they are not sleeping.
Counteracting it.
Yes. Screen time. That little iPad tablet device is a jolt of energy. Okay. That's what I call the Bustelo on a screen for kids. The Bustelo coffee on a screen. Okay. It'll wake these kids up. It'll wake me up. If I'm playing on my tablet or on my phone before bed, you better believe I'm not falling asleep. It
Yeah.
becomes hard to
Your
fall
mind is
asleep.
too active.
Yes. So letting them watch their
Yeah.
little cartoons and videos on that tablet. And then we say, but the sleep medication is not working. We need to track those things. And we need to also implement behaviors and behavior changes that will support the medication working. And
So true.
asking questions, Sherelle. I've had so many parents say to me, Miss Madeline, I was prescribed this medicine for my child. I don't really know what it's for. And I'm like, did the doctor rush you? Did the doctor not explain to you? Well, they explained
Right.
some, but I didn't understand everything. This is where we go back to the importance of translators, the importance of asking questions, the importance of of asking for written information if you need it written. You know, can I get a printout? I still need more information. And then let's go
Right.
online. Let's look up this information to see that are we clear on what this medicine is supposed to do and how it's supposed to help? Because all of that works together.
Agreed, agreed. A lot of people tend to go straight to like Google Medical and
Yes.
look up medications. And I do think that it's important for us to caution people that Google Medical is not a doctor. They tell you every single thing possible, and so it doesn't
Yes.
at all take into consideration what your personal experience is, and therefore
Yes.
we should not take that as God. The important thing that you said was talk to your pediatrician. So and ask the questions. Don't be afraid to ask questions because this is your child's life and this is your life. You want to
Mhm.
make sure that you're making the best decision, informed decision for your child, right?
Mm.
Um, Crisis prevention is often talked about, and families often try to figure out, well, how do I prevent crisis from occurring? How do you help parents understand what crisis prevention means and what their part is in this process?
I feel that the most important thing with a crisis management plan is to just acknowledge that crises are going to happen to everyone, to every parent, whether your child has a developmental delay or disability or is not, doesn't have that type of condition. Crises happen. Happen to all of us. We could slip and fall right now in the snow and break our arms. That's a crisis, right? Or you break your foot. That's a crisis. So we need to look at crisis as something that we have to just plan and prepare for. So when we were talking about earlier the cost of things, I know we are living in some very challenging financial times, but it's important to have a little money put aside because when crises happen, the what makes crises even worse is if they entail unforeseen cost and you don't have the money. So if a crisis happens and, for example, you need to take a taxi and that taxi is $100, if you have something put aside in a box somewhere or in an account somewhere, you know you have the money to at least get to the appointment or get to what you need. We also need to know that you have to have a plan, a plan. So with children with developmental delays and disabilities, you may have a medical crisis. You know, I had a child who put something up his nose, had to go to the emergency room. Again, mom had to take a cab. That was unforeseen. She had to call babysitters because she had other kids in the home. Unforeseen, that's a crisis. You know, you have a child that slips and falls off the top bunk. They're injured. That's a crisis. Or you have a child that's having a psychiatric crisis where, you know, they may be throwing things, breaking things, or getting aggressive. I always think that calling 911 should be the last resort, meaning if you've already tried to calm the child down, you tried to, give them space, you tried to distract them, we've taken anything away that could be dangerous or they could hurt themselves or hurt someone with, and this is not calming down, then we need to call for help. We need to dial 911, ask for emergency medical services to come, and we need to take the child to the hospital to see what can be done to stabilize them again. But we need to actually plan for these things. What would it look like if I need urgent child care for my other children this moment? Who do I call? Let's have those numbers on speed dial on our phones. You know, who in your building do you trust that if you need to knock on their door and say, can you watch my child for 2 hours? I have an emergency with my other child, you can trust them. Who do you know that walk-ins? Do you know where the walk-in clinics are near your community that you can just go?
Mm-hmm.
Those are the things that, are very important. Do you know the pharmacies that are 24 hours in your community that if you need to just run over there and get something because your child is running a fever or vomiting, can you run over there and get something to hold them until you can get to the medical doctor? You need to have the names, the titles, and phone numbers for all the people involved in your child's care in one accessible place. A lot of
That makes a
times,
whole lot of sense.
I've asked parents, can you give me the names of your child's therapists so I can call them? And they'll start looking through their phone. And I mean, we're all laughing. It happens to all of us. Our
It
memories,
does. It
our
definitely
memories are not
does.
great, but you
It
should
definitely
have
does.
everybody's name in one accessible place. Put it in the notes app in your phone. Have it on a piece of paper taped high on the wall, on the inside door of your closet, something like that. And then take a picture of that list and have it on your phone so that you can quickly say, this is the pediatrician, this is the pediatrician's
Right.
nurse, this is the case
Right.
manager, this is the speech therapist, the occupational therapist, the parent advocate. And it's going to be that many people that you're dealing with. So you're not going to remember
Yeah.
their names and you're not going to
It
remember
takes a
their phone
village.
numbers. It takes a village. So have it
Takes
all
a
in
whole
one
village.
place. Yes.
Yeah. And I think to add to that, something that parents don't think about when they're planning and preparing and trying to be ahead of the game is that if they have children that have significant behavioral issues, that they should get to know their local police department. They should
Yes.
go in with a picture, talk to the police about their child and what the issues are, what could happen, and
Hmm.
help to also prepare them so that if you do have to call the police, that it could be on record that,
Yes.
this child, and always say that this child has a disability, this child has a behavior
Yes.
program, this child is on medication. Because it's a
Yes.
it's a very scary time when your child is at the point where you need to call the police,
Yes.
and police are not always as sensitive and or trained to
Yes.
deal with those situations. So it's helpful to, know the people in your community, like the
Yes.
police department as well,
Yes. I
to
think
to
that's a
help
great
in those
point.
situations.
Thank you for bringing that up. I think that's a great point. I also think that I loved how you said go into the precinct. I think this is the same here in the city, but I know I live in Westchester County and they have like a separate phone number that you can call to make a non like life-threatening, but they'll still come to your house. So you can say, I need an officer to come to my home. This is not, urgent, life-threatening right now. They usually come, within an hour. And they will, you may even get the same officer, when an off because when they dispatch these calls and they see who the officer was that went to the house previously, a lot of times
Mm,
that same officer may say, oh, I know Miss Sherelle. I'll go.
right,
I know her and her
right,
son. I'll just go take
right,
care of it. Or I know Miss Madeline and
right.
her daughter. We
Mm-hmm.
want to have those relationships.
Absolutely.
And parents can be
Absolutely.
advocates also when the police comes, when EMS comes. You're still the parent. You still have a say. And like you suggested, informing them my child's on medication, my child has a disability, name the disability. In that moment, my child is autistic, he doesn't understand instructions well, my child has learning disability or intellectual disability, my child is hard of
Right,
hearing. If he's not looking at
right,
you, make sure you're the advocate. And you can
right.
offer to assist. If you can say, officer, am I able to be the one to help you hold my child, touch my child? Unless they're telling you no, because they think it's a safety issue, they may say, yes, go ahead. You be the one to put your hands on the child and lead the child to come with us. So we can be advocates. I know when I worked in mental health clinics, I used to be an advocate for my clients. When we did have to call 911, I would explain to the officers what was happening and I would say, is it okay if I walk out with you, if I walk next to my client to help them stay calm? And they would allow it. So we can advocate for our children. Absolutely.
What do you say to parents who feel they aren't a good advocate for their child, are afraid that they're not able to articulate what the need is, or Just afraid that people will not listen to them. What do you say to parents who have those kinds of concerns?
I always say to parents, you are your child's first advocate and you are their best advocate. I may have fancy language and fancy degrees, but I do not live with you. I do not know your child like you do. And I obviously do not love your child like you do. So I think as parents, you have to see your value and your strength and that you can advocate. It doesn't matter if you don't speak English or you don't speak English perfectly. That's what interpreters are for. It doesn't matter if you don't have a degree and you don't understand maybe medical terms and you don't understand how the medication works. You can still explain what you're seeing in your child and you're able to tell me what's working and not working. So, I have the utmost respect for parents. Parents are the primary advocate. Parents are
Absolutely.
the main person that knows their child. And so I want parents to approach from the perspective of, I am my child's advocate. I love my child and I do know what my child needs. And to ask for help in getting your child what they need. We are not the experts when it comes to your child. We make suggestions. Yes, we have a lot of experience as professionals, but in the end, you're the one that knows. You're the one that lives with your child and is up with your child at 3 a.m.
That is so true. And Include NYC is really a strong advocate for boosting collaboration between families and schools, between families and community providers. We provide supports for parents, like parent support groups, parent trainings to help parents to develop and feel more secure about being an advocate for their child and knowing what their rights are and what they should be advocating for. What are some of the ways that you suggest parents become partners with their children's schools and community organizations?
Well, this event that we're having today is one simple way. Join events. Sign up to be on alerts, so you get an email or a text message when there is a new event from Include NYC, for example. You can sign up to parent groups at Include NYC and also at clinics. For example, the clinic, my clinic, Manette Psychotherapy. We have parent support groups as well online in English and Spanish. So join groups. We also have a lot of organizations in the community that are doing good work, and they have events, they have health fairs, they have activities, art activities, music activities, recreational activities, and they want the families to come. So show up. Those are great opportunities to meet other parents, meet families, and also meet key people at agencies. And those are the people that you take their name, their phone number, and you make a note on your phone. This person is the director at this agency, and they do this. And I may not need this today, but I may need it in
But
the
yeah,
future. Yes.
that's right. That's
I
right.
getting people's business cards and connecting with them. We're in a technological world now. Follow us on
Hmm.
LinkedIn and follow the organization's social media page so that you stay alert to new things that are happening and show up as much as you can because those are all opportunities to meet key people, to hear about resources, to hear about things that can help your child, and also to be connected to more supports and to people that are in the same boat. We're all in the same boat. We're all just trying to help one another and to help people with disabilities. I also think that with schools, parents can volunteer. Schools are always in need of volunteers. Volunteer at your child's school. It doesn't have to be every day or every week or even every month, but volunteering, getting to know some of the people at school, befriending them. I'm a big proponent of, if I go visit an organization or a school and I'm going to meet with some people, you know, bring you a cup of coffee. It could be from a dollar cup of coffee from the bodega, but just to show, hey, I want to have a quick conversation and show me what you do. Take an interest in what the people that are working with your child are doing. So ask them,
Yes.
do you have 15 minutes? Can you show me the classroom? Show me What's happening in the school? Can you call me when there are events? And if I'm free, I'll come volunteer. You know,
Yeah.
I'm from the era where parents would even cook and bring things to activities if they could. And that was also a way to build relationship and community between the school personnel and parents.
Absolutely. And we have put in the chat our website where you can go to and find our online resources, upcoming webinars, program information, parent groups, and you can always call our website, our helpline. So there is a question, Madeline. Is there a way to get free medical ID bracelets for children with their diagnosis or a child ID? Would those things be helpful for our children to have?
They would absolutely be helpful. I don't know off the top of my head which agencies provide them for free, but I'm pretty sure if we research that, there is one. Or there's some organization that would be happy to donate if we reach out to them. Also low cost. Some of these bracelets are things that we can get even on Amazon or something like that for,
Hmm.
$10, $15, which again, it adds up, but for parents that
Hmm.
just have it and would prefer to just go on Amazon and get it or something like an Amazon. And yes, having an ID bracelet with the child's condition is always helpful, especially if your child becomes momentarily separated from you, they run off or wander
Yeah,
away. Someone
absolutely.
who's trying to help your child can actually see very quickly what's going on because we can't
Yeah.
assume that people will know that your child has a disability based on just their appearance. A lot of
Everyone,
people don't
all
know.
disabilities are not visible anyway,
That's right.
so that's definitely not the case. So we have 3 minutes left.
Oh,
Can you share with us how a little bit about your practice and what you do and how people can find you?
thank you. Manette Psychotherapy is the name of my practice. Our physical office is in the Bronx at 2960 Grand Concourse Avenue. And we also provide telehealth services on video. So we provide mental health therapy to children, teenagers, adults, and the elderly. And we do take medical insurance, including Medicaid, Medicare, all the major insurance plans, private insurance. We also provide autism evaluations for families that need a diagnosis. However, we do not do the evaluations that are required for OPWDD when it comes to psychological evals, simply because I'm not a psychologist. So I can't do a psychological evaluation for OPWDD. We do provide the psychosocial assessments for OPWDD. So still a much needed service. And we have parent groups for parents of children with special needs and for parents of children that have autism. And we also do work in the community. We have a nonprofit branch called the Manette Foundation, where we work to decrease stigma around mental illness, mental health problems, developmental delays, and we provide workshops in the community. We also partner with other organizations like Include NYC, like the Hispanic Federation, and we do fundraisers, giveaways, health fairs, all kinds of fun stuff. So you can find us on Instagram. Manette Psychotherapy is the clinic, or Manette Foundation is the foundation. We are on LinkedIn, and we have a website, ManettePsychotherapy.com.
Can you give us the website? Someone is asking, spell Manette, just so that we're clear.
Minette. That's Manette. And then the word psychotherapy, Psychotherapy.
And that's I
I'll,
put that
am I
right
able to
there for
type it in
everyone.
can I type it
Yep,
in the
you
chat?
can as
Okay.
well. You could
I'm
put
going to
that
type it
in
in
our
the chat.
last minute. Madeline, it was wonderful talking to you. Thank you for sharing
Mhm.
all those wonderful resources and helping just clarify things for parents that parents don't always know about. Um, we appreciate you. We appreciate your partnership, and we appreciate what you do in the community because there is a lack of Spanish speaking therapists and therapists in other languages for that matter. So it's always great to know where someone can find a therapist that speaks a language that is comfortable for them. So with that, it is 1 o'clock. Unfortunately, we have to go. But thank you so much. And Kylie, yes, there you go. There is there's a poll. So we're asking people to hold on for a second and please take the poll, which is both in Spanish and English. Thank you. See you soon, Madeline.
Thank you. It was a pleasure. Have a wonderful weekend, everyone.
You too. Happy Valentine's Day.
Happy Valentine's Day.
All right, bye-bye.
Bye-bye.
Thank you both so much. And I'll leave the poll open for a couple minutes just to give people a chance to respond. But once you are good, you can feel free to hop off and enjoy the rest of your day. Thank you so much. And if you're on a smartphone or tablet, you might just have to swipe over right or left to see the poll.